Today we will discuss blistering skin disorders, which includes the two most common, Pemphigus vulgaris and Bullous pemphigoid. Often students get confused how to differentiate between the two. So the next time someone asks you how dangerous these bullas are, you should be able to differentiate between the two disorders. To understand blistering skin disorders, we need to go back and understand the skin's anatomy. The skin consists of three layers. The most superficial one is the epidermis. Below it is the middle layer called the dermis, which contains blood vessels and nerves. Below it is the hypodermis. The hypodermis connects the skin to the underlying muscles. So, to understand bullous disorders, we need to know the anatomy of the epidermis. The epidermis basically consists of 5 layers. The most basal layer is called stratum basale, as the name indicates. It is called the basal layer because it consists of a single layer of keratinocytes and stem cells as well. So whenever there is trauma to the skin, it is the basal layer which regenerates. The second layer, which is very important in our discussion, is the stratum spinosum. It is called spinosum because it is from the word spiny. It consists of keratinocytes which are attached to each other through desmosomes. The desmosomes are basically composed of proteins called desmogleins. And these are important proteins because they connect those keratinocytes together. So whenever there is friction applied to the skin surface, the skin does not fall apart of each other and stay together as a single unit. Whenever there is a problem in this layer and the keratinocytes no longer stay together to each other, there will be bullous formation, which is today our topic. The layer above it is stratum granulosum, and the layer above that is stratum lucidum, which consists of dead cells, basically the keratinocytes, and is thick in the palms and soles for extra protection. The most superficial layer is the stratum corneum, which consists of keratinocytes which are dead, having no nuclei. So the layers of the skin are shown in this image. The superficial one is the stratum corneum, then the lucidum, then the stratum granulosum, the stratum spinosum, very important, and the stratum basale. These are the desmosomes shown in this picture. The desmosome basically keep the keratinocytes together. It is a connection between the keratinocytes, while the hemidesmosome connects these keratinocytes to the basement membrane, which are shown at the bottom of the picture. So the first disorder is the Pemphigus vulgaris. So this is potentially fatal disease. How it develops? Basically, as we mentioned, that both of these disorders are autoimmune. It means that the body's own immune system attacks its cells. So the IgG antibodies are formed against desmoglein 1 and desmoglein 3. These are the protein present in the desmosome in the stratum spinosum. So which kind of hypersensitivity reaction will this be? This will be a type 2 hypersensitivity reaction. Whenever there is antibody production against the proteins or any other body tissues, this is a type 2 hypersensitivity reaction. So if you understand this one line, that IgG antibodies against the desmogleins, you can understand everything down the line. So this is a type 2 hypersensitivity reaction against these two molecules. So the type 2 hypersensitivity reaction, it is similar in the Bullous pemphigoid as well, but that is against the hemidesmosomes. So this will be a differentiating point between the two. And this disease is most common in middle age, like 40 to 60 years. In older adults, but like 40 to 60 years. And it is a potentially fatal disease. So the gross morphology contains flaccid bullas and intraepidermal bullas, because if you see, it is the bullas are forming between the keratinocytes in the stratum spinosum layer. So these are flaccid because they are relative superior layers of the skin. While when you study the Bullous pemphigoid, those are tense bullas because those are formed near the basement membrane. So these are intraepidermal. That's why the skin layers are separating, and whenever you apply attraction force to it, any friction when it applies, it ruptures easily. This is called Nikolsky sign. And very important point, it involves the oral mucosa. So whenever you study the immunofluorescence pattern, it will show a reticular pattern. You see here, the keratinocytes, so IgG antibodies are produced against these desmogleins. So as the shape of these antibodies, you can compare that the pattern will be reticular as so. The next disorder, the histological appearance is shown in the picture. You see in this diagram, the basement membrane and the basal layer that is attached to the basement membrane, but the problem is in the spiny layer against the desmosomes. So you see these antibodies, these are formed against the desmosomes, which results in a intraepidermal flaccid bullous. The next disorder is bullous pemphigoid. Bullous pemphigoid is relatively milder disease, less severe in the pemphigus vulgaris, and it is seen in older adults. It is seen in greater than 60 years of age, while the pemphigus was from like 40 to 60 years of age. So it is also a type 2 hypersensitivity reaction as mentioned earlier. Again, there are the IgG antibodies against the hemidesmosomes. Now you see the hemidesmosome are a little deeper into the skin. So these bullas are supradermal and or subepidermal. So these kind of bullas are tense bullas. Why are they tense? Because they are formed against a little deeper in the skin. So as shown in this picture, you see the superficial epidermis, it is separated, and the bulla is formed below it. It is called supradermal or subepidermal bullas. So these are tense bullas. It contains eosinophils. And the important point is, whenever you apply traction force to these kind of bullas, they are tense. They do not erupt so easily as were happening in the pemphigus vulgaris. Also, the oral mucosa is spared. While the oral mucosa was involved in the pemphigus vulgaris, you think of the bullous pemphigoid as a little milder disease with tense bullas. So the immunofluorescence pattern, you can predict it. How this will be a linear pattern at the dermoepidermal junction, because the antibodies are forming against the hemidesmosome, which are in a linear fashion and attached to the basement membrane. So that's why the immunofluorescence pattern is also linear. So the take home points for solving any questions is, first of all, when there is an MCQ given, look at the age. If the age is between 40 to 60, think of pemphigus. If it is older, like greater than 60, think of bullous pemphigoid. If the bullas are flaccid, think of pemphigus vulgaris. And if it is tense, then think of bullous pemphigoid. If the histologic appearance, it is very obvious. If it is mild disease, it is bullous pemphigoid. If it is severe, it is pemphigus vulgaris. If oral cavity is involved, it is pemphigus vulgaris. If it is spared, then it is bullous pemphigoid. The immunofluorescence pattern, if reticular, it is pemphigus vulgaris. If it is linear, it is bullous pemphigoid. If the Nikolsky sign is positive, it is pemphigus. If it is negative, it is bullous pemphigoid. All these points are summarized in this last slide as well. I hope this video will help you solve your MCQ question. Thank you.